I know you've done a lot of work using barbershops for health equity, so I'm wondering if you can tell me a little bit about why barbershops are such important spaces for health conversations in the Black community.
I think barbershops are safe spaces in the Black community because they're trusted organizations, right? They're the kid who grew up around the corner who started a business. It's the local athlete who gets his hair cut at that barbershop that went off to college or maybe even to a professional organization. It's the plumber, it's the bartender, it's all the local people who live in the area that come to one place with a common ground to shoot the shaving cream, if you will,
Uh-huh.
and talk a little bit about things that they're either dealing with, things they're passionate about, and because they trust the barber, because it's probably the person who's helped them in funerals, birthdays, graduations, job interviews, and the list goes on and on and on. They begin to trust that person. So when the barbershops introduce or implement programs like what we're doing at DKB Med and this Fade Out project, the clients, the customers, the guests that come into the shop trust what the barbershop is doing. So, Caroline, a lot of people in our community don't use the word depression. What are some of the ways it actually shows up in real life for like a barber who is cutting hair? What are some identifying things that we should be looking for?
Yeah, so one key thing that I think shows up for all of us is hopelessness. So, like
Mm,
a real feeling of hopelessness and despair is a common thing that permeates everyone who has depression. So, I often say, like, when you notice a change in someone, like, usually they would come in as like an upbeat person and they're more withdrawn. Sometimes it also shows up as irritability or like having a short fuse. So, I think sometimes when a person shows up and usually they're pretty cool and conversational with the barber, but they show up and they seem to have a chip on their shoulder. And that's unusual for them. Sometimes that short fuse or irritability or anger outbursts can also be a sign of depression, which I think is important because oftentimes people kind of think of, oh, the depressed person is so withdrawn. But it doesn't
mm.
always show up that way. But oftentimes that despair and hopelessness is really present.
So, are you talking about a person that maybe um, we have been servicing for a while? What about that person that maybe is their first time coming in? What are some things that we could look for?
Yeah, so I think what you talked about in terms of like the natural trust that your barbers establish with a person and then the person begins to open up. Sometimes people will open up pretty quickly about what's burdening them.
Mhm.
And sometimes people will talk about things like not feeling a will to live or having thoughts of maybe wanting to harm themselves or experiences they've had with other people that they care about or love that are struggling. So oftentimes think of like you have the person in the chair and they're connected to all the people that they care about and love. So often think when I'm doing this work around depression screening or suicide prevention, like it's not just the person that I'm talking to, it's like all the people that they touch in their lives too. So sometimes just asking people questions about how they're doing, like what burdens are they carrying today, you know? And people will open up and talk to the barber or to a person that they care about what's going on.
When we're working with someone, especially in our community, when someone comes in, and a lot of time, often the cues that we are given is, oh, just, put your head down and keep shoving. You can push through this, or you'll be okay. Or why don't you just pray about it? Have you prayed about it? What are some indicators that maybe we should say maybe the time that we can encourage them to seek some professional help?
Yeah, so I always say prayer can coexist with help. You know, like so I
Yeah,
do think that there's that part. Like I'm like, if I have a broken arm, I can pray about it, but I need a doctor, right? To
right.
set
That's
my
good.
arm. So I think
Yeah.
the same thing about people who are struggling with burdens of mental health and also drug and alcohol problems too. Like there's treatments that help unburden those things. So we can be in a space where we're addressing that through our spiritual lives, but there's also a space to have a professional. So I always say, like, when the depression or the burden becomes so much that it's like changing your life and your outlook, often think about like listening to people's tone of their speech. So oftentimes people that are suffering from depression, like, man, they're negative. right?
Mhm.
Like everything's very, very negative. So I always think that's like a warning sign when you said, oh, like what would somebody notice if it was the first time that they met them? You know, there are people that move through the world in a negative limelight,
Yeah.
right? But for many people, when they're burdened by that negativity, that can be a sign of depression for sure. Why do you think that mental health conversations still can feel really uncomfortable in the Black community? And maybe what is your thinking in terms of strategies to kind of reduce stigma and open up these conversations so that people who historically and traditionally maybe not have sought help can get help that makes their lives better?
Well, I think a lot of time with the family dynamic, especially in the Black community, is you have to be a man first, right? Um, as a boy, we're taught, you don't cry, toughen up, right? Don't cry, stop being a crybaby. Uh, get yourself together. Don't embarrass yourself. Don't embarrass the family. Like these are things that you hear. If you watched recently the Michael Jackson biopic, you can see where Joe Jackson was very militant, but also very controlling on how the family was being viewed,
Mhm.
although he was very abusive at home. And these are things that we've heard. And if you've seen the biopic, then you may have seen some of that stuff. But that is a real dynamic that happens and exists in the Black community. And it's taken a long time for us to trust professionals when it comes to seeking help, right? Because it's a sign of weakness. It's a sign of cowardice. Like you're not supposed to show that. You're supposed to control that, manage your emotions, right? And you're not allowed to feel a certain way. Oh, your boss said something to you? Well, suck it up. Go do your job. And it could be that could also stem from just slavery times when masters say something, you keep your mouth shut because master. I mean, I think that's a real thing that has gone through generation after generation. And so then those great grandparents that taught your grandparents that taught your dad, right, how to manage their fears, frustrations, anger, resentment, emotion has been suppressed. And so when you see violence and emotion come out in a certain way, it's hard to talk about those things. Those aren't things that are easy to talk about. And if you go back a few generations, especially in the Black community, they're very quiet and reserved because they just learn to keep everything in. It's not good to let everybody know your business. And so I think that's some of the challenges that we face today.
Yeah, I think that's such an important call out around like intergenerational adaptation to the real harm of racism. I think that's
Mhm,
such a true piece of this. And
mhm,
like, how do you heal that? I mean, it's a
mhm.
huge question.
You, it's a conversation that most people don't want to have, and usually it's combated with, oh, well, we're not living in those times, or that was so long ago, get over it. It's the same thing as just saying to a person, well, just push through it. It's the same thing as saying, well, did you pray about it? It's the same passive energy. Well, we're not in those times anymore. Well, I mean, if you look around, we're dealing with some very uncomfortable times right now, and people of color are being challenged in many ways that we haven't seen um, openly,
Yeah.
openly in politics and policies that are changing and the way it's affecting jobs. And those people got to go to work,
Right.
right? And they have to push through it, and they
Right.
have to push through the challenges that they're having, and then even the superiors in their job looking and speaking to them in a way, right, for fear of, and then they can't go home to their spouse or their children with that energy, right? So these are the things that we're carrying, our families are carrying, our parents are carrying, right? And it's
Well,
a
and I
real,
think
it's a real
racism
thing.
is a structural element that impacts depression in the Black community.
Absolutely,
And it
absolutely,
needs to be as addressed as such.
yeah,
Because I think that, right, like that's pushed down too and not talked about and not given voice to the real
yeah,
harm of racism day to day, and especially against the backdrop of context of what's happening today in many
right.
ways, you know,
So we're
like
affected
more
by what's
present.
happening. Yeah, we're affected by what's happening socially, right? We're affected by what's happening in policy. We're affected what's happening through social media and absorbing all of this in real time, right? So, what are some other ways that it actually shows up in real life as an individual? I'm at home with my children, or I'm at home with my spouse, or I have a coworker that I'm dealing with, and I'm seeing some things because they're being affected by everything that they're seeing, whether it's on social media, whether it's a policy change, or the conversations that are happening about our politics or what's happening in the world,
Yeah.
and we're seeing all this stuff in real time. What are some things and some ways that it actually shows up in real life, and how do we help that person that we're dealing with every day?
Yeah, I mean, we're talking a little bit about depression, but I always say the other side of depression is anxiety, right? Which is
Hmm.
also a treatable condition. And I think there's a lot of things that are going on that are collectively increasing folks' anxiety. And there's a lot being written about how much more our young people and children are much more anxious now than ever before. And I think there is all this input, right? And how are you supposed to manage
Yeah,
all of it,
yeah,
right?
it's a lot. It's a lot. Yeah, and
Um,
and for us in the barbershop, we're cycling people in every 20 minutes, every
yeah,
half hour, every 45 minutes, right? It's like a doctor. It's a new relationship, new scenario, new system, new whatever. And some people's nervous systems are shot, right? And they're sitting at the core of our nervous system while we're spinning this chair,
yeah.
right? So if somebody is depressed, right, what are some of the changes that, us as family members or co-workers and friends may notice before the person themselves notice?
Yeah. Or I'm thinking about like for that 20 minutes, that's like a precious moment that a person could get a break, right?
Yeah,
And
yeah.
like your team is taking care of that person. Even though it's
Mhm.
for 20 minutes, it's a 20-minute of a what I'll call a caring contact. Like,
Mhm.
hey man, I care about you, right? Like you're in my chair, I care about you. Like that
Yeah.
has power.
Yeah,
Like,
absolutely. Absolutely. I've personally seen it. I've experienced it. Clients I'm holding and crying, clients that I'm pulling them to the side and we're in the stairwell, either praying or having a moment. I've experienced this real time. And
yeah.
so what we're doing with DKB Med in this fade out project and doing some screening, what would somebody expect during a depression screening?
Yeah, so it's 9 simple questions about how things have been going over the past month. So the screening itself, answering the questions is very simple. And then what we do as mental health clinicians is we look at the answers to those questions. And those questions are about things like, how's your appetite? How are you sleeping? Have you been
Hmm.
having any thoughts about wishing you were dead?
Hmm.
They're basic questions about how people are doing over the last several weeks. And that screening is such that if a person scores high on all those things, that's a warning that things might not be quite right. And then the
Hmm.
actual conversation with a mental health clinician, then that person can get more details about like, oh, what is actually going on with this person. I think,
Right.
the most concern for us in these conversations is suicide risk, right? So
Yeah.
many, many people who are depressed have suicidal thoughts.
Hmm.
Some have an intention and a plan to act on those thoughts. Sometimes people just have more like what I call ambient thoughts that come and go.
Yeah.
But suicide is a real risk factor for people with untreated depression. So it's always important for us as mental health clinicians to be having conversations about safety.
I've recently been going through my own personal therapy, and those questions come up. And they're a little challenging for me because it's not like I'm losing sleep. I don't have thoughts about killing myself, and I'm not having those issues. But there are some things that I need to unpack in therapy. So, do you find that when a customer or a guest who's going through the screening process that we're having at these barbershops and the locations that we're using, do you find that the client being able to do it in private on their phone and answer the questions has a greater impact than it does trying to share that with their barber? And even though they trust their barber, maybe some of these questions are so sensitive that we can let them know, like, hey, the information you're putting on the phone, I don't receive that. But
Yeah.
because I love and care for you, do you find that that's an easier way? And what are some ways, what are some prompts or maybe some words we can use to encourage, fill this out? I don't get this information. This is for you, not for me.
Yeah, I think guaranteeing the privacy and confidentiality is important. And I
Mhm.
think then people are a little bit more honest too. And I do think people filling stuff out on their phones, we're just so used to doing that in our daily
Yeah.
life for every single thing that we do.
Mhm.
And it's so quick and easy that that's a nice way to deliver it. I mean, we've done it on pieces of paper. We've done it in ways in which people ask the question. I think people are more honest when it's me, myself, and I
Yeah.
answering the
I think
question,
there's a psychological effect. Like this is my phone, right?
and it's
I'm
private.
using my right.
Yeah.
So what about the guest who's like, hey, if I go through this, are they going to give me medication? I don't want medication. I don't like medication. I don't want to have to deal with that. What are some things that you would encourage the barbers to say or to explain with their guests if they ask those types of questions?
Yeah, medication is one tool in the toolbox. Not everyone takes medication. Not everyone needs medication.
Mhm.
Therapy and counseling, medication, exercise, going to the gym, being
Mhm.
outside in nature. Like there's a lot of things that are really valid ways in which people can start feeling better. And the customer, the patient, is in charge of their what they choose, right?
Mhm.
So oftentimes patients will come and a medication will be recommended. They still have a choice as to whether or not they want to take a medication. I think people sometimes are fearful of medications, that it's going to change them and they'll be a different person. So sometimes people can try medications and see if it can be beneficial. If it's not, they could try something else. People are afraid of side effects oftentimes, or am I going to have to be on this medication forever? When I explain medicine to people, sometimes I say, like, when you're depressed, it's almost like you're in the middle of a rushing river, and you have 100,000 thoughts, and you just can't stop them. And
Right.
sometimes the medicine like slows that river down so you can get your bearings.
Mhm.
And that can be actually helpful to like start to feel better.
What other questions do you have for me? I have a few more for you, but do you have any more questions for me?
Yeah. Um, I'm interested like about when your barbers are interacting with people, how are they able to encourage them to get help?
If they don't have the information to encourage them to get help, they don't know. They're going to ask somebody who does, right?
Yeah.
Usually it comes to me. If I'm in the barber shop, they're like, I'm not sure. Hey, Tariq. And then that usually how the conversation goes.
Uh-huh.
Um, but I think what happens is with the Fade Out project and what we're doing with DKB Med is we're empowering barbershops to give them those tools necessary and those resources necessary to impact those communities so that way, if they notice a guest is dealing with something, or maybe they're shutting down and maybe their behavior has changed, they can encourage it and say, hey, look, we just had a project here. I have something that might be helpful to you. So giving them resources and a way to empower them, I think helps to empower the community because we need education to give the information, right? If you don't know where to look, you have to ask. Most people aren't willing to ask. And so when you have people who are empowered because they have the information and the education behind it, it's easier to say, hey, I have something this might help.
And when you think about like educating the barbers,
Mhm.
and the experiences that we've had, what do you think are the key components that have helped the barbers feel a little bit more comfortable, like talking about mental health with their clients, or even on the screening days, being able to say, hey, you could go talk to a mental health person.
Mhm. I think the word mental health sometimes has such a negative connotation. I think the word therapy, especially in the Black community, has a negative connotation. I think there's a little shift in how they're looking at therapy now because there are on social media people talking about it and people discussing like, "Hey, I went to a therapist and I'm going to tell you it was the best thing I've done." So I think there's a small shift, but it goes back to trusting the medical professional. And so with that being said, what are some things that the medical practitioner or doctors can do better to build trust with Black patients?
Listening,
Mm.
right? Like
Well, even
abandoning judgment,
right. That's good. Abandoning judgment is good.
empathy, right? Empathy.
Yeah, I
Like
like
I
those
always think
too.
it's pretty simple, Tyreek. Like, but people bring their bias, they bring their,
Right.
into the room. Like,
So So with that being said, I think that's why projects like what we're doing with fade out
Yeah.
helps because the barbers have been listening for years.
Yeah.
We've been the ear. We are empathetic. I
Yeah.
understand your struggle. I'm walking the struggle with you. I know what it's like to be a parent. I know what it's like to be a Black parent. I know what it's like to be a Latino parent. I know what it's like to hear the different families and the people that are coming and sitting in a chair and the common struggles, right? So because we've been listening for such a long
Mm.
time, because we understand and we have that empathy for them, it's easy for us to give those type of resources. But we can be the bridge, the gap, or the conduit, if you will, to helping these medical professionals. That's why I like working with DKB Med. Since I've
Yeah.
worked with them, I have found that my barbers are better equipped with information to
Yeah.
help the clients.
Right.
Prior to that, there was no real resource. A lot of it was coming to me and the relationships that I've had with other organizations before I met DKB Med.
Yeah.
And so now that I'm working with DKB Med and we're partnering to do these fade out projects, I'm becoming more educated in some of these spaces.
Mhm.
I'm giving my team the tools necessary to help. And so I'm seeing that growth development. We've already been listeners. We already understand the struggle, right? But connecting them with people that we trust. And so we're able, but we're one barbershop,
Right.
right? We're one barbershop. We're 18 barbershops, eight of us in there that we can only do but so much. So getting more barbershops involved, getting more community involvement, continuing these programs really, really help. When we
I
did
think
our
like
last fade out project, the girls who came and did the testing, right? When y'all were there to test, the amount of people that came in and to see how that was boots on the ground, that was communities outreach is so much different than walking into a sterile office that's cold and doesn't have the emotional connection to community, right?
Mhm.
Where the barbershop does.
Right.
So what was that experience like for you?
Yeah, I think I felt like I was the recipient of like borrowed trust by being in the
Mm,
space, right?
hmm. That's good.
Because I was able to establish very quick rapport with the customers
Mm.
who, they didn't know me. I'm just somebody, and I'm a mental health professional, whatever that means, right?
Right, right, right,
Because we
right,
all have our biases, right? People have
right.
biases towards mental health professionals, right?
Mhm.
So, but I think I felt a sense of borrowed trust within the environment, and I was really struck by how incredibly open people were immediately.
Mm.
And
It's a different space though. That's
it's
that's
so
what
amazing.
it's a different space. It's truly outreach to go into a medical office or to an office and fill out a form and sit there and think everybody's kind of looking at you. At the barbershop, everyone's already there. They're already having conversations. They're already sitting there. It's like the lack of the judgment is so low, right? That they don't have to feel like all eyes are on me. We're all here experiencing the same thing in real time. And so I'm glad that that's what you felt when you were there in the shop. It was
Yeah.
borrowed trust. So if somebody's
It
watching
makes
this
me
video,
think about like how do we collectively do innovative things in community to heal people, right?
right?
And that
It's
we're
more
doing that
projects,
across difference, like who am I? Like this, mental health
yeah,
professional white woman, right? Like
right.
that we can work across difference, right? Because at the end of the day, we're just like humans having a human
Real
experience, and it's hard
the
being human.
the reality is to answer your question, how do we do this? It's more projects like this.
Yeah.
It's taking someone who has medical education, understanding that the problem is there's a disconnect from community in the Black community with the medical professionals, and using a conduit or a resource that does have connection with community, that is receiving education from a company that is offering medical education, empowering them to create that trust that we can share that trust with the medical professional. So I'm so glad that you experienced that in real time while you were at the bar because it was different than being in the office, right? It wasn't
Okay.
this another day at the office.
Right. And I can be right in my role at work of saying like, how do we better meet the needs of Black men who are suffering with depression? And then I can
hmm
come to a barbershop and have all these rich, meaningful conversations.
hmm hmm
It's not that complicated.
These rich, meaningful conversations are happening every day in every barbershop across the country. They really, really are. And so if we can continue to get the education to them with the programs that we're doing here at DKB Med, if someone was watching this video and listening to the two of us have this open dialogue about depression and medical professionals and education and how barbershops are connecting those two worlds with community, and they needed help, what would be the first step?
Well, there's the crisis text line, and you can just text 741-741 and get help right away to talk to someone if you're in need, or you can dial 988, which is a crisis hotline that would get you to someone who can connect you right away. So those are the two quickest, easiest ways. If you're in an emergency situation and you need help right away. Other people that are good to talk to in the community are pastors and
Mhm.
neighbors and
Mhm.
primary care doctors and barbers, right?
Yeah, yeah.
To be connected to community-based care. They're
Well,
testing the
Caroline,
fire alarm in my building.
oh yeah. Well, we didn't really hear it, so it's fine. But Caroline, thank you so much for your time today. Thank you for bringing this education. Thank you for what you're doing and allowing um, barbers to have this resource and being a medical professional and sharing that trust that you talk about from our community to yours.
Thank you. Thank you, Tariq, for all the innovative work you're doing. This is how we make a difference, right?
Yeah, absolutely.
For sure.